Hi, this series focuses on services and community. I'm Dr. Elissa Kaplan, licensed clinical social worker and your founder and host, helping to empower and educate on a large scale. Together, we launch Resiliency's mission remains to reduce stigma and social isolation for children with special needs and their families by preventing it through resiliency building. The learning from these podcasts will also create a better environment for the healthy development of all children. Today's talk is with a therapist that uses horses in her treatment services. Yes, horses. Heather will explain how horses are helping children with special needs attain their individual goals by using a super fun and motivational approach to therapy. This may be the first time you even hear about it. Heather Meyer is a certified occupational therapy assistant licensed in New York and Connecticut. She holds a certification as an equine specialist in mental health and learning from PATH International, the Professional Association of Therapeutic Horsemanship. Heather has been in the field of pediatric therapy for over 30 years, treating children with both physical and invisible disabilities, and uses hippotherapy in her private OT practice called Stable Equine Therapy and Learning. It's based in New York. Welcome, Heather.
Thank you, Dr. Kaplan. I'm so happy to be here with you. I'm really excited to share this approach and my experiences.
Today, listeners, the best way to understand the podcast is to understand two important things. First, we use equine and horse interchangeably during the podcast. Oh, if we refer to hippotherapy, we are not referring to hippopotamuses. We are referring to horses. Hippo means horse in Latin, so it refers to therapy on a horse. Heather, can you tell me a little bit about the different types of horses or equine therapy programs available to children with special needs?
Yes, absolutely. Today, we're going to talk about 3 different types of programs for children with special needs. It's important to know that all 3 of these programs have very different goals and objectives for the children. The first program we'll talk about is called Equine Assisted Learning. This is also sometimes referred to as a ground program. The reason they call it a ground program is your feet never leave the ground. The children are not on the horse. They don't ever ride the horse during these programs. And ground programs primarily focus on the horse-human connection, the horse-human bond. There's a very strong emphasis put on building confidence and self-reliance in our participants. These equine-assisted learning programs may be led by teachers, therapists, facilitators, or equine specialists. Our participants engage in various trust and confidence building activities with the horse, like grooming, learning how to put the halter on the horse and lead the horse. Eventually, our participants build the skills to lead the horse through an obstacle course in our arena. We do things like read books to the horses, which the kids love. They learn about horse traits and characteristics, what they like to eat, how they communicate with us. Kids love feeding their horses, especially treats like carrots and apples. Horses are like mirrors, which is very helpful when children are learning about social cues and body language. Our kids who struggle with social skills, it's very helpful for them. For example, a child that has difficulty figuring out personal space or how their behavior impacts others, they will quickly learn that when they get too close to their pony, the pony is going to let them know. We get to model really appropriate interactions with the horse and then generalize that into learning with peers. There's also a wonderful opportunity to connect socially with peers at the barn. Equine assisted learning is an approach that promotes the development of life skills, education, social emotional goals, all of which we anticipate will carry over into their everyday lives at home, in school, with peers, etc.
Wow, that's so interesting, Heather's program sounds great, and I'm wondering who would be a good candidate for the program.
Ground programs can be structured for people of any age, Dr. Kaplan, but today we're specifically talking about children, and the ages that I treat in these groups are typically around 3 or 4 years old to 16 years old. We offer these programs to all children. We do see children with social and emotional challenges like anxiety, depression, OCD. We see children on the autism spectrum, children with ADHD, global delays, and children with physical disabilities. Often parents choose this particular type of program for the social element. We like to create small groups which really enhance the experience.
That is really fantastic that you provide this service to all children, because that is what inclusion is all about. But I'm wondering, what if the child's nonverbal? Can they still be in the group?
Yes, absolutely. Our groups are open to all children. We have quite a few participants who are nonverbal in our programs. They communicate with us and the horses in their own unique way. We're always happy to incorporate adaptive communication devices into our sessions. We're also happy to do some basic signing with our kids.
Your flexibility is outstanding because it's going to get more kids to have this opportunity. I'm wondering, thinking about the opportunity, how can families pay for this ground program?
Families pay out of pocket for the ground program, or they use their self-direction stipend. In fact, I work with quite a few families that use self-direction. Insurance, however, does not pay for ground programs.
That's too bad insurance can't help, but I'm glad to hear self-direction can. And as a side note to families that may be listening, self-direction can be accessed through the Office for People with Developmental Disabilities, which is a state-run agency, also known as OPWDD. And OPWDD provides services and funding for families of children with developmental disabilities if they qualify. So it's not based on family's income, it's based on the child's disability and what that means to the child. If a child qualifies, they might get a budget called a self-direction budget that might cover this or other recreational activities. For more information, Google OPWDD front door and OPWDD self-direction. That's just one way to fund this.
Dr. Kaplan, in addition to the equine assisted learning programs we just talked about, I provide another program called Equine Assisted Therapy, which is also referred to as hippotherapy. Think of hippotherapy as an OT session on the horse. Hippotherapy is when a licensed and certified occupational, physical, or speech therapist uses a horse in their treatment session. The child is on the horse and the therapist is using the movement of the horse to attain functional goals and outcomes for the child. The therapist starts by assessing the child to determine what goals and objectives will be. This is based exclusively on your child's needs. For example, if your child has challenges with sensory processing and is low energy, low arousal, we might put your child on a pony that has quick, bouncy steps, which would provide this child with tons of the proprioceptive input that they're craving and wake up their sensory system. Alternatively, if your child presents with tightness in their legs, we might choose a pony or horse that will provide long, slow, and rhythmic movement, which will help relax rather than stimulate the child's system. The participant might engage in various overlaid activities into the session, like reaching for rings, tossing them onto a peg, or throwing beanbags into a bucket, all while on the horse. Sometimes we move into different positions, like facing backwards or facing sideways, which might challenge the body to weight shift or balance differently. Dr. Kaplan, the primary goals and objectives of hippotherapy are to help the child reach whatever their functional goals are. For some, the goals might be to improve their postural control and stability. For others, it might be to better regulate their sensory system. Whatever the goal may be, the unique qualities of the horse's movement really help them to get there.
Wow, that's really a lot it can do. Many people don't even know how horses can help. I understand hippotherapy is an evidence-based treatment. How or why is it known to work?
That's a great question. And not to get too overly technical, but when the horse walks, it gives three types of movement. Its pelvis moves in a rotational, lateral, and anterior posterior way. And this movement travels through the thin bareback pad on its back. Just as a side note, we don't use a saddle because the thick leather from the saddle would dull the quality of the movement we're looking for. This movement comes through and into the pelvis of the child. The horse takes about 3,000 steps in a 30-minute session. The child's body is absorbing 3,000 steps of this amazing three-dimensional movement, which promotes active responses in the child, which leads to a multitude of benefits. Some of the benefits include improved sensory motor functioning, improved balance coordination, improves postural control and stability, improved respiratory function, which improves speech production. We also see a real increase in the participants' confidence and their feelings of self-worth. It's a movement that really cannot be duplicated anywhere else, not in a sensory gym, not on any piece of equipment. It's a unique treatment that has a really profound and evidence-based impact.
I'm excited to get this information to the people that can use it. It sounds too good to be true, but it's great. And so how does a child qualify for hippotherapy?
In order for a child to qualify for hippotherapy, they must qualify for OT services. Their parent is required to get a prescription and a medical clearance from the pediatrician. Also, it's important to remember, Dr. Kaplan, this is a powerful approach that is not appropriate for all children. Each child must be carefully assessed to determine whether or not this is a good fit for them.
Okay. You mentioned ground therapy might be covered by self-direction. Self-direction, would that also cover hippotherapy or insurance cover it or private pay? How can people pay for that?
Some parents pay privately. Some parents are able to bill through their insurance companies. Self-direction does not cover hippotherapy. The reason being, self-direction is intended to cover recreational activities, and hippotherapy is not recreational, it's therapeutic.
Well, that makes sense. But the kids do seem to certainly deserve to have this wonderful service. Can these skills that they learn in the horse and in the barn, can they translate into the classroom and other settings?
Yes, absolutely. We're looking to see the generalization into other settings. Also, Dr. Kaplan, it really can change the way that parents see their kids and their kids' resiliency.
That's my favorite part of everything that we're doing for kids. What would you say to parents that are a little nervous about having their kids around horses?
Our ponies are accustomed to working with special needs children. They're patient, kind, and calm. There's typically a 3-to-1 ratio of adult to child in each session. Safety is really a priority for us.
Great. I understand there's a third program that uses horses. Although you don't provide it, can you share some of the vital information about it for our families?
Sure, I'd be happy to. The last program we'll talk about today is called Therapeutic or Adaptive Riding. It's a bit of a misnomer, as despite its name, it's not actually therapy, it's recreation. Therapeutic riding is when a riding instructor teaches a child with special needs how to ride a horse. So I don't provide therapeutic riding. Parents can access these programs through therapeutic riding facilities in their area. Just remember, this is not providing functional goals per se. It's teaching the child how to ride a horse, and it's recreational fun.
It's good that these kids can have some fun too. Where can parents find you?
I work out of 3 different barns in New York. One is in the Bronx, one is in Westchester County, and one is in Putnam County. If you'd like more information about equine assisted therapy and learning programs, please check out my website, stabletherapyandlearning.com.
This is some great information you shared with us today, Heather. Thank you.
Thank you, Dr. Kaplan. I enjoyed being here with you today. Thank you for providing such great podcasts to families and for all you do for our community.
On behalf of all kids and families, we really appreciate your time.